Hi everyone, my name is Tonk and I'm going to talk about the parts of the upper limb and the shoulder. So it consists of the arm part and the pectoral part of the clavicle and the scapula. So the scapula has its bony features here, as we can see the medial border and its lateral border here. Then it has then we can see the spine of the scapula, which is superior to the infraspinous fossa and inferior to the supraspinous fossa, which is above it. Scapula has its coracoid process and acromion process. Acromion process articulates here with the clavicle. You can see it well here. And then its coracoid process, which is this bone right here. And they are important for the muscle attachment and the joint articulation. And then we have the glenoid fossa and glenoid cavity, where the humerus meets the scapula. It's here glenoid fossa. And this is the humerus, the head of the humerus with the surgical neck here, inferior to it, and anatomical neck like in between the head and the tubercles. And then we also have the clavicle here, which has two important parts, which is the acromion end and the sternal end. The acromial end, sternal end. The acromial end, it articulates with the acromion part of the scapula again. And here is the humerus. So this is the head of the humerus, and we can see the greater and the lesser tubercles here, which are separated with the intertubercular groove. And we also can see on the humerus the deltoid tuberosity, where the deltoid muscles attaches, which is important muscle mostly for the abduction of the arm. And we can see on the posterior part of the arm, we can see the olecranon fossa, which creates a space here for ulna, and we can see the medial and lateral epicondyle. So the medial epicondyle is right here, and the lateral epicondyle is right here. We can see here it says that it's articular area of the condyle of the humerus, but the more lateral part is called the capitulum, and above it we can see the radial fossa, and the capitulum articulates with the radius. And then on the more medial, closer to the medial part, closer to the medial epicondyle, we can see the trochlea, which articulates with the ulna and is inferior to the coronoid fossa. So then we have the joints. We have the sternoclavicular joint. Well, I remove the clavicle for the heart. So here we can see the sternum, which covers the heart. That's why it was removed. And here is the clavicle. So this is the sternoclavicle, or also known as the SC joint. And on the other side we have AC joint, acromioclavicular joint with the articulation with the scapula. And then we have the glenohumeral joint with the gleno as a glenoid fossa or cavity, and the humeral head. We have the glenoid labrum, which is around. We have the glenoid labrum, which is around the glenoid fossa. And we have coracoacromial ligament, which is underneath the AC joint. Then we have the glenohumeral ligaments, which are the superior, middle, and the inferior one. And then we have the humeroradial joint, which articulates with the which is articulation of the humerus and the radius. And then we have humeroulnar joint, which is the humerus and the ulna. And then we have the there are a lot of ligaments here. Some important ones are the radial collateral ligament. No, this is annular. This is the one. Radial collateral ligament, which is located laterally and deep and superior to annular ligament, which we saw here. And then we have the more medially located ulnar collateral ligament, which is here. So these were the ligaments, joints, and the bones of the upper arm. And then we have muscles. So the muscles of the upper arm can be called have different areas, and first of them is the rotator cuff, which makes sure that the humeral head stays in the glenoid cavity and helps with shoulder movements such as the abduction, adduction, and rotation. So the rotator cuff is the supraspinatus here, infraspinatus here, and the teres minor here. And then we have one last muscle on the scapula, subscapularis, which is underneath the scapula. And then we have the posterior arm, which helps with the extension of the arm. We have the medial head of the tricep brachii, which is here. Here is the lateral head, and this is the long head. And then we have the anterior arm, which helps with the flexion and also the supination of the forearm. Yes, so here we can see the coracobrachialis. And here we can see the teres major, which is also part of the posterior arm. But back to the anterior arm, we can see here the long head and the short head of the bicep brachii, and we also have brachialis, which is right here. And also we have a deltoid muscle, which is here, which helps with the shoulder abduction. And we have the special area of this part, which is right here, and is surrounded by the trapezius muscle, latissimus dorsi, and the rhomboid major. And this triangular space allow us for the for listening to lungs when we go see doctor, for example. So the next part is the nerves. I'll remove all muscles so we can see it clearly. So the nerves of the upper limb come from the brachial plexus, and the brachial plexus originates from the ventral rami of spinal nerves C5 to T1, and is organized into roots, trunks, division cords, and branches. So we can see the C5 is right here. No, that's already trunk here. Anterior ramus of the fifth cervical vertebrae. So it goes all the way from here until T1, which T1 nerve is underneath T1. Should be here. Yes, this is the anterior ramus of the first thoracic vertebrae. And then these rami go into the trunks. We can see the superior trunk here, middle and the inferior trunk here, and they go into anterior and posterior divisions, which are here. This is the one of the posterior, and this is one of the anterior divisions. And then they form the cords, which we can see. The cords are lateral, posterior, and medial. So the lateral, posterior, and last one medial. Maybe it's better to see it from the front side, from the anterior. Yes, so this is the middle, the lateral, and the posterior. And then they branch into the nerves, which supply different, which innervate different parts of the body. We can see the axillary nerve here, which comes to the deltoid muscle. No, this is we can see the axillary nerve right here to the deltoid muscle. And then we can see musculocutaneous nerve here, which supplies which innervates the biceps. Then we can see the median nerve, and then we can see the ulnar and the radial. So radial nerve is right here, and the ulnar nerve is here. So these are the nerves of the upper limb from the brachial plexus. And then we have the blood vessels. So I will remove the sternum to better see. So we have the heart here, and we can see the arch of aorta, which then branches into the brachiocephalic trunk and goes into the right common carotid artery, which then branches into other branches in the and supplies the brain. Then we have the right subclavian artery and right axillary artery. And then on the left side we have again left common carotid artery and the left subclavian artery. and left axillary artery. Here. And then we have the brachial artery on both sides, which is here, which can be seen here. And then we have the vein. So we have the axillary vein, which is here, and the cephalic vein right here. And then we have the basilic vein, and small brachial veins, and the brachiocephalic vein on the right and left side as well. That's it. Thank you for watching.